Well, hello, everybody. We'll get started in just a moment. We're just letting folks into the webinar. So give us about 30 seconds and then we'll get going. Okay, so I think we'll go ahead and get started. So glad that you had a chance to join us today. I'm Allison Foster. I'm the Executive Secretary for Delta Mega, and I'll be hosting today's presentation. So as I'm sure you know, Delta Mega is the 100-year-old honorary society for public health. We just had our anniversary last year. There are over 130 chapters at C for Credit schools and programs, which have inducted a combined 30,000 plus members over the years. So we've been hosting the Innovative Curricula Award since 2001. So it has a wonderful history of recognizing faculty with their innovations in curricula. And the award itself was designed to stimulate the development of such curricula to prepare graduates in meeting the challenges of contemporary public health. And every year we are just so pleased to see the nominations that are submitted to us for this award. So in our tradition, we highlight some of those nominations in a webinar series. So today you're going to hear from two of the nominees. I'm very pleased to introduce them to you. So we're first going to hear from Michelle Burbage, who's going to present on case studies in global health, challenges, and proven success. And then we'll hear from Malinee Neelamegam from University of North Texas, principles of epidemiology. So two great topics for you to hear about today. They're each going to take about 10 minutes and walk you through the curricula. If you have any questions or comments, just go ahead and type them in the chat. And then we'll save a little bit of time at the end for Q&A. And all together, we'll have you out of here in about 30 minutes. You can get on with your day. So with that, I'm going to unshare my screen. And then, yep, Dr. Burbage, I'm going to go ahead and turn it over to you.
Hey, can you see my screen?
Yep, it looks great.
Perfect. Well, hi, everyone. Thank you so much for having me today to talk about my class, Case Studies in Global Health, Challenges and Proven Success. So as Allison introduced me, I'm Michelle Burbage. I'm an associate professor as well as program director for the Master of Public Health program at the University of Cincinnati. So in this course, students explore successes, failures, and challenges within the global health field. So in this course, we examine evidence-based strategies, policies, and interventions that shape health outcomes. So the course really introduces contemporary global health concepts. And again, this is through a series of case studies, hence the name, the course being Case Studies in Global Health. And we analyze risk factors, determinants of health, health disparities, and many, many different topics are covered. So it's a 15-week course, and within those 15 weeks, we cover gender equality, water and sanitation, maternal and child health, disease elimination, eradication, non-communicable diseases, and so many other things. Those are just a few topics that we cover. And these topics are covered through looking through a lens of best practices in global health. So we look at global health and health education theories and ethical public health principles, as well as program evaluation. So the course is open to all students in all disciplines, providing a very comprehensive understanding of global health challenges and solutions. In the course, we do use a textbook. You can see the picture on this slide. It's called Millions Saved, New Cases of Proven Success in Global Health. We use the 3rd edition of this book. This resource presents a wealth of information for the students on different global health programs that are successful, but they also highlight not so successful global health projects as well. So you can kind of see what works and what doesn't work and why that would be in different settings or different circumstances. So factors that we look at for each of the different case studies include the history of the country, health goals, strategies of the project, cost effectiveness, outcomes, the project scale, and broader implications that the project had in the field of global health. So every week, students read about 1 to 3 case studies on a specific health topic, and they engage in very thoughtful discussion about what was successful, what were challenges or barriers, and what lessons were learned. So I encourage students during these discussions to bring in insights from their other courses, so other things they've learned in other classes, bring it to the table in these discussions, as well as their own experiences. So this fosters a very dynamic and well-rounded learning environment for the students. So like I said, this global health course uses case studies to explore best practices in the field. Through these case studies, we examine all these different topics. And so you can see on this slide, this is just a few of the case studies from the book. So this was taken from the table of contents from the book. And you can see the difference. So we cover meningitis, belt in Africa. We talk about reducing cancer risk in China, mosquito, trying to lower malaria spraying mosquitoes in different parts of Africa. So lots of different topics are covered. In addition to that, I also try to have other aspects of the course be engaging in addition to the case studies. So students have the opportunity to interact with at least 2 to 3 local and international speakers. So we invite them in person or through Zoom, depending on where they're located. And these speakers share their community engaged work, offering valuable insights into the lessons they've learned in their own experiences in global health and the different projects they've been a part of. So over the years, we've had several remarkable speakers, including the founder of the Catalyst Foundation, who discussed their mission to combat human trafficking in Vietnam, especially among indigenous communities. Her name is Caroline, and she shared how holistic community development approaches can be used, as well as how culture, policy, stigma can all shape efforts in global health in that region. Another speaker we had was a community health researcher from India who provided an in-depth look at the health dynamics among Indian borders, so the borders of India with other countries, and how this can impact health outcomes. We also had a local physician share their work with an NGO in Guatemala, providing telehealth services in a sustainable manner to provide sustainable healthcare access to underserved populations. To complement these speakers, I also play 2 films. So I do play videos in my course. These are to highlight real-world impacts of global health from a community perspective. So one is Strangers. This is a 2022 Nigerian drama based on true events that looks at a young boy who contracts a waterborne disease in a remote village, and it underscores the importance of cultural influences on people seeking treatment and empowering communities to drive change. The second film is an Indian production film that looks at the challenges when it comes to misconceptions that traditions and values have to be abandoned to achieve public health gains, which is definitely not true. So it highlights the importance of respecting cultural values while addressing health needs, and also focuses on gender-based violence and women's health in general. So I play films in my course because it allows students to really connect to the human side of global health issues in a way that textbooks can't. So the case studies are fantastic in providing more details on best practices and learning more strategically about how to implement ethical global health practices, but these movies really put faces to these stories. So students gain a deeper understanding of real world challenges and the triumphs of global health. So in my experience as an educator, one of the most important components of public health education is hands-on learning opportunities. So I also try to provide assignments that allow them to have that ability to be more hands-on. So I've developed a partnership with an NGO to create a very meaningful and collaborative project that benefits not only the students, but also the NGO and the community they serve. So this partnership has allowed students to apply their knowledge in this class as well as in other classes in an impactful way that bridges the gap between theory and practice in global health. So the organization we partner with is SAO, or Sanya Aitia. So this organization, SAO, is a fantastic organization that part partners with us to allow students to work on case studies that challenges them to create actionable solutions. So on the screen, you can see the founder and president and CEO of SAO. Her name is Gabby. She is a very inspiring leader who founded SAO to uplift Haitian communities through education, health promotion, and economic development. And so the motto of this organization is helping Haitians help each other. So the whole idea of this organization is to help Haitians be have their projects be sustainable and meaningful, but also allowing for self-sufficiency within the community. And so currently they operate in 11 different areas of Haiti. So in addition to Gabby, who's a big part of this project, Dr. Frank Ray is a board member of SAO, and he participates in the course by providing several classes, coming to several classes through Teams and answering student questions they might have. So overall, what the students do is they work on a case study that this SAO organization develops, and they have to apply the knowledge they gained throughout the semester to create an innovative, culturally sensitive, and feasible approach to a public health issue that was identified by this organization. So it's a high collaboration between the students and the organization. It's community driven, and it's designed to produce practical, impactful results. And at the end of the semester, board members of the organization can attend class to see final presentations, to see what the students created over the course of the semester. And I'm proud to say that last year, one of the ideas that the students developed is actually being utilized this year within the organization with one of the issues that we're hoping that the students could solve or think of solutions to. So overall, while I wrap up, because I know I only have a minute to go, I also have students role play. So they do a mock annual report to stakeholders, presenting as if they are presenting to stakeholders for like the Global Fund to fight AIDS or TB and malaria or some other kind of program. And they have to use evidence-based information to demonstrate why the program will succeed or not succeed with meeting its goals. And they also have to write a final paper in the class as well. And like I said in the beginning, this class is very much discussion-based with case studies. This is not a lecture-based class. While I do give mini lectures, it's all about discussions and learning from each other and learning from different perspectives. So I know I'm out of time, so that is my conclusion. I know we're saving questions to the end, but I just want to thank you all for listening to me, and I'm happy to answer any questions you have at the end. Thank you.
All right. Thank you, Dr. Burbage. And now we're go ahead and put your questions in the chat, and we're going to turn this over to Dr. Neelamegam.
Hi, good afternoon. Are you able to see my screen? Hi, I am Malinee Neelamegam, and I'm an assistant professor, and I teach the Principles of Epidemiology course here at the College of Public Health at UNT Health Science Center. The Principles of Epidemiology is our foundational course. Every MPH student who begins their journey at our college starts with this. When I began teaching this course about 3 years ago, I realized that it was crucial not only to introduce students to the core EPI concepts, but also to ensure that the material felt accessible, engaging, and applicable to real-world public health scenarios. And my goal in revamping the course was to make EPI approachable and relevant while integrating practical applications alongside theory. I wanted students to see EPI as more than just numbers and statistics, and to really grasp its power to improve health in communities and address critical public health challenges. We offer this course in person every fall to a cohort of approximately 40 students, ensuring that students get both theoretical grounding and practical insights into the field. For students who are brand new to public health, this class lays a strong foundation, and our goal is to give students the tool and perspectives they need to tackle real-world public health challenges effectively throughout their studies and future careers. Taught over 16 weeks, the structure of the course is organized into 3 main sections, each building on the last to provide students with a comprehensive understanding of EPI. In the first section, students are introduced to the field of EPI, where they delve into foundational concepts of morbidity and mortality. And in the second section, the focus shifts to different study designs that are used in epidemiology. And this section also includes in-depth studies of measures of association, such as relative risk and odds ratio, and emphasizes the importance of critically evaluating these measures by considering the impact of factors like chance or bias or confounding and interactions. In the final section, the course culminates with concepts related to estimating the potential for prevention and understanding causation and the principles of screening. The course is delivered in a flipped classroom format where students engage with the course content through weekly modules that open about 2 weeks in advance on Canvas. And each module includes comprehensive materials, including recorded didactic lectures, which students are expected to review before attending class. And this pre-class preparation ensures that students arrive ready to delve deeper into the material. During the in-class sessions, the sessions begin with a content quiz to assess understanding, which is followed by about 40 minutes of guest lecture that explores the week's module through an applied case-based approach. Additionally, each week in class, students participate in graded problem-based learning activities in teams that allows them to collaboratively apply the principles that they have learned. And the class concludes with students breaking out into their service learning project teams where they work on their capstone project, applying their learning to address public health issues identified by a community partner. And usually during this time, I walk around the class to address any concerns the group may have. And this structure helps us reinforce the course material, but also fosters critical thinking, collaboration, and practical application of EPI. The teaching philosophy of the course is rooted in the commitment to using high-impact educational practices to impart foundational skills in EPI, while also recognizing and addressing the diverse learning needs of our students. Each week, students can access course content on Canvas in various formats, including recorded lectures, PowerPoint slides with full transcript, or interactive short modules that are created with Articulate RISE, which features knowledge checks to reinforce learning. And these formats cater to auditory learners, visual learners, or those who benefit from periodic breaks and interactive elements to maintain focus. And feedback from students has shown that this approach significantly reduces their anxiety about the material and allows them to engage with content in ways that align with their preferred learning styles. We initially set out to understand if students preferred interactive RISE modules better, and if we could phase out traditional recorded lectures altogether. But we have repeatedly learned that they liked having the option of using different modes of content delivery. The assessment of students in the course is designed to be multifaceted, so we ensure that there's a comprehensive evaluation of both their foundational knowledge as well as the practical application of this knowledge. Students are not only assessed on their understanding of the course content through their quizzes and problem sets, which they complete independently. They also are evaluated on their ability to apply this foundational knowledge to real-world practice-based problems. And this is achieved through the weekly problem-based learning activities where students work in teams to tackle applied public health scenarios. It's also done through their work on the service learning project, which serves as the course's capstone, allowing them to demonstrate their ability to translate what they have learned into practical solutions. One of the assignments designed in a team-based activity focuses on the critical evaluation of AI-generated EPI study designs. And the purpose of this assignment is to enhance the students' ability to critically assess the strengths and limitations inherent in EPI studies. So specifically, students will use ChatGPT to generate an initial study design based on an assigned research topic. They then analyze this AI-produced design and they'll consider factors like feasibility, methodology, recruitment challenges, and potential biases. And this exercise not only deepens their understanding of the EPI methods, but it builds their critical thinking and collaborative problem-solving skills. The service learning project in the class serves as the cumulative capstone experience that allows them to apply their knowledge to public health issues. Students are placed in teams of 5 at the start of the course and assigned to a community partner, and the community partner will act as their client throughout the project. Each community partner presents a specific research question related to a public health challenge they are facing, and student teams then work collaboratively with them to design an epi study that addresses this research question, at the same time considering specific limitations or constraints that the community partners face. So to ensure that successful project completion is met, students will be given dedicated time each week during class to break out into their groups and work on the project. And the in-class sections provide as an opportunity for their teams to collaborate, discuss their project, and each session concludes with team share-outs where group present their work to seek guidance and get feedback from their peers and from me. And the project is scaffolded throughout the semester, and students submit sections of their final deliverable. And this gives me enough time to provide feedback to them, and they can make corrections as they go. The culmination of the project is their final presentation, where they present their study design and work plan to their peers, as well as to a panel of community partners who are the end users of this design. Now, one of the biggest challenges that I consistently face when assigning group work is managing student conflicts. I'm sure many of you experience the same issue. Students often complain about conflicts that arise in their groups, and sometimes relying solely on peer evaluation just doesn't cut it. So to address this, I introduced something called team contract. Essentially, I give students complete autonomy to outline how their group will function. So at the beginning of the semester, they set their own expectations, they clarify their responsibilities, and they decide how and when they'll communicate or meet and openly discuss limitation or scheduling conflicts from the start. But most importantly, each group also determines their own consequences if members don't meet expectations. And this includes clear guidelines on when they want me as the instructor to step in. And I find that this approach significantly reduces conflict because students have ownership over the process and they're proactive in problem solving. And interestingly, it has helped improve overall accountability within groups. Community partners play a vital role in the class. They do this in 2 steps. One is they actively engage in the course through invited in-class guest lectures, and the second is through participation as the community client in the service learning project. During guest lectures, they bring their applied practical practice-based perspective into foundational EPI principles covered in the class, and the collaboration that we are able to achieve through the service learning project helps us foster meaningful connections between academic partners and public health communities. Our goal is to continue listening to our students as well as our community partners on what skills they would like graduating MPH students to have, and to use that to continue to tweak this class. And we hope to continue learning about the pedagogical methods and technology and to continuously update the course. Thank you so much for the opportunity to share this content with you. If you have any thoughts, advice, or suggestions, please reach out to me.
Well, thank you so much. So Dr. Burbage, if you want to come back on camera. And those are both terrific presentations. We're going to go ahead and take some questions now. All right. So first question for Dr. Neelamegam, is there a form/rubric/guidelines you use for your students to discuss group work expectations that you'd be willing to share?
Yes, so each assignment, so if it's for the service learning project, there's a separate rubric for each of the sections that we have scaffolded. And for each of the class problem solving group activity, there's a specific rubric for that as well. And the rubrics are often available on Canvas from the beginning of the semester, so students are very clear about what is expected of them in their group activities. And I'll be happy to share that.
I'll put the two of you in touch. All right. So let's take a question I think that both of you could answer is what are your plans, or do you have plans? And if so, what are they for changing the course in the future?
So I can go first. So my course has changed over the last few years quite a bit. So originally it was just case studies and that was it. And so over the years I added more components. So I added the movies and the guest speakers, and then I added the community partner. So what I like to do moving forward is continue to hone in on that collaborative approach with the community partner, with that NGO, and making sure that the projects are still meaningful to that group as well as their communities, and seeing how we can expand past the class. So I'm hoping it doesn't just end within the 15 weeks, but students can continue on working with the organization after the class is done.
I think for me is I love the different technologies that are coming up for engagement, and the disconnect that I see a lot is teaching the same course online versus in person. I can gauge a lot of things just by body language, looking at students' faces, but I can't get that online. And so lately I've been exploring a lot of different things, and we have changed discussions online, and we are trying out this thing called skits where we are acting out the public health issue and then breaking it out and asking students to comment, and hoping that this helps like online engagement better and trying to translate what we're doing in class to online.
Yeah, a lot of good new technology for us to explore. So the next question is also for both of you is, what advice would you have to a faculty that wants to do something similar? Like they're inspired by your curriculum, they want to start. Where would they start? What advice would you have for them?
So for me, it's just take a chance. So when I first was teaching this class, like I said, it was much different than what it is now. And at first I was a little scared to take a chance to bring in community partners and to change the format, but just go for it. I mean, you can always rechange it. And the other thing is, I'm sure at your university, there's support to help you find. So for me, it was find that community partner. So finding the place within your university that can help be a liaison to find someone to match up and be a part if you don't have those connections already.
I think for me is, having the instructional designers, because this is truly their expertise. While we are the content experts, like how to translate this to teaching is something that they're really good at. So a lot of times to connect with them and to tell them what you are envisioning for the course and help, getting their help to try to translate that in your classroom.
Okay. All right. Well, that was great advice, because that's what we hope is that as we continue with this awards program, is that we see new, faculty be able to try new things and get inspired by the submissions that we've received. So I think we'll end it there. So we end on time. Thanks again for joining. And just a reminder for those of you who are online and for our presenters, you can share with your colleagues. We will have another round of awards this year, and the information can be found on our website, and the deadline is September. So you've got all summer to figure out about your nomination. So thank you again to our presenters, and we'll have the video of this, a recording of this webinar up very soon. All right, thank you so much. Bye-bye.